Good evening to all, and a warm welcome to all homeopathic doctor and IFPH member. And today is our 2690th day of uninterrupted daily webinar of IFPH on 1st May 2026 at 8:30 p.m. Today's our guest is Dr. Sumana Kumari Panda, MD Homeopathic, retired District Medical Officer Homeopathy, Cuttack Circle, and Government of Odisha. And the ma'am has very much experience. She is consulting the Dhableshwar Homeopathic Clinic and Homeopathic Clinic experience of 35 years to treat chronic cases of all types, more specifically of gynae. And her today's topic is just 1 minute. Her today's topic is study of bowel nosodes, Morgan puree. Now I'm inviting ma'am to start her presentation.
Hello.
Hello ma'am. Hello. Good evening ma'am, and a warm welcome to you.
Good evening. Thank you, Dr. Deepmala. Am I audible to you?
Yes ma'am. Yes ma'am.
Hello.
Yes ma'am. You are audible. You are audible.
Hello.
Ma'am. Hello
Yeah.
ma'am. You are audible ma'am.
Audible.
Okay. Thank you. Thank you, Dhanesh. So, good evening to everyone. At the outset, I am very much thankful to my teacher, Dr. Sani sir, all the organizers, my good friend, Dr. Dhanesh, and all the doctors, Dr. Ram Pravesh ji. So, many regards, my heartfelt regards to everyone. Namaste. So now coming to the topic, really my topic is on bowel nodule Morgan Pure. I will straight come to share my screen now. Is it visible?
Yes. Listen.
Okay. So my topic is on bowel nodules. Today we will discuss on the Morgan Pure. In previous sessions already I had discussed vividly about the bowel nodules, where to use and how it came to the notice and how the discovery was taken over by the doctors. So Batch and Robert. So next I had already discussed psychotico, proteus and dysenterico vividly with the case in relation to cases. Today I will go to the Morgan Pure, Bachelor's Morgan Pure. Morgan Pure already we have discussed it that the gram-negative bacilli short anaerobic non-lactose fermenting organisms, and these are isolated from the feces of children who are suffering from somodiarrhea, which was caused by Bacillus morgan. Is the type where this is the non-lactose organism most frequently found in stools in greatest numbers, and many more drugs are related to this. Usually we find in our clinics who are using the bowel nodules, everyone might have experienced that commonly we go for bowel nodule, Morgan Pure, Morgan Gatner, Psychotico, Dysenterico, Proteus, Gatner. So these are of very common use, and Morgan is the most common use. Many more cases are covered up with Morgan batch. So Morgan batch again subdivided into two nodules, that is the Morgan Gatner and Morgan Pure. Today we are going to discuss on Morgan. For Morgan Pure, the keynote symptom is congestion. As we know, for Morgan Gatner, the keynote is inflammation. Here, the congestion is seen in many systems. What we find specifically on GI tract, respiratory tract, liver and gallbladder also, skin and urogenital tract. So we find the in collagen system also we find in case of arthritis where there is congestion, Morgan Cure is much more of use. So next coming to adaptability, we find the uh, clinical conditions where there is a congestion. In any system you can have, in the circulatory system, heart, we may find angina, bartholinitis. I had a very good experience with bartholinitis, bronchitis, dermatitis, eczema, emphysema, gallstone. A very good drug for Northern Cure to control. Might not be to remove out the stone. It might help or not. I can't give with much reliability, but to maintenance, to control pain, or if the patient says that I will go for surgery 6 months after, 8 months after, in that condition, to keep the patient painless or without any marked symptom, we may go for Morgan Cure. It's a very good drug in those conditions if symptoms cover it. Without that, in jaundice also we find Morgan Cure is a very good drug in case of jaundice. Of course, to some extent, lycopodium also is a good drug, or Morgan Gardner's helps to some extent, but Morgan Gardner helps in condition of cholecystitis, and in calculus we find Morgan Gardner frequently indicated in case of renal calculus, whereas in the gallbladder calculus we find Morgan Cure is most of the time frequently indicated. And in case of rheumatoid arthritis, pharyngitis, pruritus, very good drug for Morgan Cure. Chronic pruritus with chronic leukorrhea, cervical erosion, we find Morgan Cure a very good drug. So after the failure of other indicated drugs or where the sulfur fails, we may go for Morgan Cure. So in clinical sphere of action already discussed, keynote I told you the congestion, and the most prototype medicine is sulfur. Of course, the more number of drugs we find similar to Morgan Cure, but the most prototype where we find the symptoms are reflected in similarly in both the drugs like sulfur and Morgan. That is prototype drug is sulfur. And coming to adaptability, we find a florid type of complexion, that is the reddish face with the red cheeks, with reddish hue we find in case of the complexion. Patients with a blooming face, cutaneous congestion, just like to some extent we may find in a belladonna also like this. In sulfur also we find this type of complexion. So also we find in Morgan. Dark or fair complexion, dark more than fair, dark complexion also we may find. Plethoric persons and with blueness of the extremities, where we find the anemic cases also we find Morgan Cure a very good drug indicated. Coming to the mental picture, we find the in case of Morgan Cure, they both the Morgan drugs, Morgan Gardner and Morgan Cure, they are very introspective. They introspect themselves, they analyze themselves. They are very irritable drugs also. And here when Morgan Cure we find irritability specifically during menopause and before menses also. I have seen cases with this reliable symptom, irritability aggravation before menses. Very much irritable before menses and during menses. And when other indicated constitutional drugs fails, we may think of Morgan Cure in those conditions. And very melancholic, depressed, weepy, prefers solitude, and but fear of being alone. Aversion to company, fear of being alone. What we find in lycopodium in sepia, so also we find in case of Morgan Cure. Here we find fear of a crowd, fear of ill health, fear of unknown things. These are very well indicated in case of Morgan Cure. anxious, apprehensive about the state of health. What we find in phosphorus, in nitric acid, in kali iode, even in arsenic, we find the similar symptoms. In ars iode, we find the similar symptoms. To some extent, in storinum also, we find this symptom, and so also in morganpier. Suicidal tendency, if we will go for bowel nodules, the only bowel nodule morganpier is indicated, particularly from job pain. No other bowel nodule is indicated on this symptom. Frustration of mind and introspection. Introspection we find much more. Of course, I have mentioned in last as a last symptom, but morganpier is very good, very well indicated in case of introspection. Both organs, Morgan Gardner and morganpier. Coming to physical generals, morganpier is very hot and congestion, dryness, burning in different parts of the body. We find desire for butter, egg, desire for fat. We find in case of morganpier. And so sweets very well indicated, just like sulfur also we find. In Morgan Gardner also we find desire for sweet. Desire for sweet we find under the bowel nodules. We find in Morgan Gardner, morganpier, Proteus, and psychotico, dysentrico, bacillus number 10. In these drugs we find desire for sweet. And desire for eggs we find in Morgan Gardner, morganpier, and Proteus. Morganpier has desire for eggs in some cases, aversion to eggs, and intolerance to eggs also. We find in case of diarrhea after eggs, we find in case of morganpier. After fat food, we find in case of morganpier. So here also we find fatty food, desire for fatty food under bowel nodules, we find in dysentrico, Morgan Gardner, morganpier, Proteus, psychotico. In these bowel nodules, we find desire for fat. And desire for butter, we find in morganpier, Proteus, and psychotico. In 3 bowel nodules, we find desire for butter. And appetite usually absent in morning, sinking feeling in stomach by 11 am, relieved after eating, we find in case of sulfur, similarly in case of morganpier. But in Morgan Gardner, to some extent, we are getting this symptom, but the sinking feeling, pain in epigastrium, aggravation after eating we get in case of Morgan Gardner, whereas relieved in case of morganpier. Stool usually we find in morganpier, it is of diarrhea type, but sometimes also we get constipated. Anal fissure we may get in case of morganpier. In some cases, we find alternate constipation and diarrhea also, but most of the cases in morganpier, we find diarrhea. Whereas in Morgan Gardner, we find most of the cases constipated. In morganpier, I will come across under rectum that diarrhea aggravation in morning hours, sudden urging, we find, but just no, in morning hours we find in morganpier, but not just after waking up. Just after waking up, we find in case of sulfur, but under bowel nodules we find in psychotico. Under psychotico, we find this symptom, and this is a very reliable symptom in case of psychotico. If I have seen this, this is a very reliable symptom when prescribed. In case of psychotico, but in morganpier, in morning hour aggravation. Sleep is light, restless, insomnia we find in case of morganpier, sweat, profuse perspiration, offensive perspiration, and mostly perspiration from axilla we find in case of morganpier. And intolerance to woolen clothing, as this is a hot case. Coming to modalities, We find aggravation in morning, especially diarrhea, urging for stool, headache, loss of appetite, stiffness of the tongue, limbs, and fingers. We find in case of in morning. And aggravation at night, we find the skin symptoms, specifically skin symptoms, suffocative attacks, shortness of the breath, aggravation at night. We find pain extremities, heat sensation in feet. We find aggravation at night. Heat and hot weather aggravation we find in headache and skin eruptions. Traveling aggravation also we find in case of headache. Specifically, I will come across while discussing head, that is migraine type of headache. Eating after aggravation, urging for stool. Usually, eating after relieves the pain in epigastrium, most of these symptoms. But the urging for stool is aggravated after eating. Winter aggravation is bronchitis, washing aggravation, skin eruptions, aggravation after washing, just like sulfur, furan, anti-crude, clematis, we find aggravation after washing, and a headache aggravation after excitement, traveling also aggravates headache. And amelioration eating after gastric pain and acidity, hydration. Coming to the particular features, we find congestive type of headache. I told you that I have seen now for migraine. I have seen I have a very good experience with Morgan Pure. Cure rate is very good in case of Morgan Pure, specifically migraine. Migraine is very difficult to deal. Everybody might have experience. We are having very good drugs for that. Um, but usually I go for the constitutional remedy. But when the constitutional remedy like so sulfur, specifically sulfur, calcarea carb, calcarea salt, or sepia, or calicarb, or sorinum, tuberculinum, when indicated but fails, in those cases I have gone for Morgan Pure with the symptoms that the congestive headache, aggravation in morning, aggravation traveling with a hot face, vomiting reliefs. Vomiting reliefs in case of Morgan Pure, just like sanguinaria, Nox vomica, we find the vomiting reliefs. But they couldn't cure in those cases. Morgan Pure cures the case. I have a very good experience. I can say more reliably that we can go for Morgan Pure in those cases. In a headache, specifically congestive type of a headache. Migraine, specifically migraine. The other drugs under bowel nodules, we can go for Morgan batch or dysentery. When the anxiety is too much and when arsenic fails, we may think of dysentery in those cases. But when there is very less anxiety, irritability is more. Along with vomiting reliefs, aggravation in morning, aggravation hot weather, aggravation traveling, in those cases, we may think of mild irritability. At that time, with introspection, we may think of bilious vomiting also. We can think of Morgan Pure, and very reliable drug. Okay. Complete alopecia also we may think of. Scalp is very sensitive. We can think of Morgan Pure. Under ear symptoms like otorrhea, catarrhal deafness, we noise in ear, and under nose we can think of postnasal catarrh, dryness of the nasal mucosa. I told you the congestion is the keynote. So we can add the congestion to head, neck, ear, nose, throat, like that. If we will add it to throat, that is a dry, raw, granular, fast, warning, choking sensation in throat. Recurrent tonsillitis, yes, a very, very good drug with a history of past history of recurrent tonsillitis. Usually, we are going for the surplus remedies like calcarea carb, like sorinum, like mercury, like silesia, tuberculinum. we may think of these drugs, but sulfur, we may go for the repeated tonsillar abscess like hipersol, like phytolacca, but when fails, if we are getting the other general features of Morgan cure, then we can think of Morgan cure in the history of recurrent tonsillitis. In Barretta also, this is a very, very good drug, Barretta car, Barretta iode, according to symptom similarity. But Morgan cure also we are getting this symptom and a very reliable symptom in case of recurrent tonsillitis. Thyroid gland swollen, we may go for thyroid gland swollen in case of Morgan cure. Today only I have in a first prescription I have gone for Morgan cure as he has gone through many more homeopathic drugs with the symptoms of a large thyroid swelling in the left side today I had seen, and the its measurement is on scan report 8.7 centimeter into 6.7 centimeter into 6.4 centimeter. So much large with the farm swelling it was, and it has shifted the trachea to the right side. He is having some choking sensation in trachea, suffocative attacks in throat, aggravation at night, and other symptoms also. And after failure of sulfur, he has come to approach me today only for the first time. And I had gone with him Morgan Pure 30 in the diluted doses twice daily. Today only I had prescribed. So let's see what happens after 2 3 months. So next is gastrointestinal symptoms. Dryness of mouth, tongue and lips, tongue dry, raw, white coated, swollen and burning sensation, tongue and lips stiff in the morning. Ulcers, mouth ulcers, repeated mouth ulcers with offensive mouth, with the offensive saliva, we may think of Morgan cure. Corners of the mouth cracked, where many more drugs are there, like Pandurago, Silesia, Mercury, many more drugs. We have for cracked corners of the mouth, or Morgan cure it can be thought of also. In stomach, hyperacidity, water brush, heartburn, irritation, burning in throat and stomach, nausea, vomiting. Already I had discussed that the vomiting, bilious vomiting, which relieves a headache, and nausea after from eating, but pain and hyperacidity symptoms are relieved after eating, and urging for stool aggravation after eating. A very effective drug, Morgan cure for peptic ulcer, specifically duodenal ulcer. And good medicine for jaundice and gallstones. I have seen a very good drug, very very reliable drug for jaundice under the bowel nodules. The single drug comes under the bowel nodule repository, that is Morgan cure. So a very good drug. And jaundice due to gallstone, if it is there, then we may think of Morgan cure very well. Then when the other indicated remedies fail. So rectum constipation or bowel motion without strain, or in morning or immediately after meal, stool pestic, foul, and for hemorrhoids also we can think of Morgan cure is really a very good drug for varicose veins, varicose ulcers, and varicosities. So due to varicosity, we may find piles, we may find bleeding piles, itching or painful anal fissures also Morgan cure is indicated. Pruritus ani we may think of also. Coming to urinary symptoms, I can say Morgan cure is a very good drug for diabetes mellitus. Type 2 diabetes mellitus, Morgan cure is a very good drug. When the other indicated remedies, specifically when sulfur fails, we can think of Morgan cure. Along with other indicated mother tinctures, I am going for bowel nodule Morgan cure. In urine is frequent, painful, corrosive, and strong smell. Under the respiratory symptoms, as we had told, history of pneumonia, a very good symptom here not mentioned, ailment never well since last pneumonia. Really basing upon this symptom, I have gone for Morgan Cure because in 2020 to 2022, 23, COVID was prevalent, and the patient says that for last 3-4 years, madam, I developed these shortness of breath, frequent attacks of cough and cold, frequent attacks of difficult breathing. So after that only I developed. Before that I didn't have this. I had a very bad type of COVID attack and I was hospitalized. From that I came home. I recovered, but after that the frequent cough and cold. So in those cases, if shortness of breath is aggravated at night with loose, sticky expectoration aggravation morning, dry cough aggravation at night. If the other indicated drugs fails, we can well think of Morgan Cure, never well since last pneumonia or bronchopneumonia. This is a very, very reliable symptom in case of Morgan Cure. So in cardiovascular, we had already discussed varicose veins, varicose ulcers, process of sluggish circulation, high blood pressure. For high blood pressure, Morgan Cure is also a good drug. Under female sexual system, we can think of pruritus volvi, vaginae, leukorrhea, very, very good. Corrosive, offensive, brown, green or yellow. Bartholinitis, recurrent bartholinitis, even after surgery, Morgan Cure is a very, very reliable drug. Okay. So metrorrhagia, menorrhagia, polyps, fibroid, and I have very good experience with the bartholinitis, I can say, and we can well think of bartholinitis in Morgan Cure. Musculoskeletal system, it takes generalized arthritis affecting all the joints of the body, including spine, rheumatoid arthritis, rheumatic arthritis, osteoarthritis, periarthritis, specifically of knees, and osteo and the neck also for cervical spondylosis. Morgan Cure is a very, very good drug. Sore, tender nape of neck, aggravation from moving the head first time, and a continued motion of the head relieves pain. And a hot application when aggravates, we can think of Morgan Cure. Okay. Now, for osteoporosis also, we find Morgan Cure is a very, very good drug. Under back, generalized fibrositis of neck, and lungs fibrosis also, very good drug, Morgan Cure. Okay. Shoulder, dorsal, lumbar, sacroiliac region, cervical spondylosis, pain in neck and back, aggravation at night, aggravation from heat, aggravation on beginning the moving the head, not only rosters. It might be calcarea, it might be natrum salt, it might be psychotico, it might be Morgan Cure. But more indicated if the sulfur symptoms are there, general symptoms, then we can go for Morgan Cure. Morgan Cure is a very, very good drug for cervical spondylosis. Lumbago, acute or chronic lumbago, we can think of Morgan. Under upper limbs, pain in shoulders, arms, wrists, hands, aggravation at night, arms and hands puffy, stiff, weak, poor grip, with numbness and tingling hands at night, fingers stiff in morning, neuritis, arms pain and aggravation at night. These symptoms also we will get in case of midrinum most of the time, and we will differentiate how to go for midrinum and how to go for Morgan. Warts on hands, nodules on fingers. Warts on hands also we are having very good drugs like natroncar, anacardium, natramur. We are very, very good drugs. Pain and swelling of finger joints, especially metacarpophalangeal. We are also having very good drugs like ruta, caspicata, lithium, carvamon, phos. Very good drugs. Brittleness, lower limbs, pain, stiffness and swelling of joints of lower limbs with numbness, tingling sensation, tactile sensation lost, we find it in case of Morgan Pure. Cold sensation in patches, we find the Morgan Pure, we will find covers the symptoms of psora, psychosis and syphilis. All three miasms are covered up under Morgan Pure, we will find like this. Under in skin, this is the tactile sensation is lost, we find, and the cold sensation in patches we find. Pain in soles and heels with the thick skin and cracks of the soles, the pain in heels along with the cracks, we find Morgan Pure is a very well indicated drug, just like petroleum we find, and the graphite is also we find in case of Morgan. Heat is too hot at night and offensive sweat, restless feet we are getting, and periarthritis, osteoarthritis of knee joints already discussed. In skin, we have various types of skin, various types of skin eruptions. We may find the eczema or dry eczema specifically of the feet, of the heels, of the lips, of the eyebrows, area of face. We find mostly dry type of eruptions we find in case of Morgan Pure. And scaly eruption in psoriasis we find scaly eruptions we find in case of Morgan Pure. And in the genital area for chronic pruritus, always Morgan Pure is a very, very good drug. In case of diabetes, usually diabetic type 2 diabetes mellitus patients commonly comes with the symptoms of pruritus with chronic leukorrhea. They have taken frequent antibiotics, repeated antibiotics, and after that failure. If these cases are coming, then we may think of if the generals indicating towards sulfur and we are getting failure. In those cases, most of the time we can think of Morgan Pure to cure the cases. Itching, scalding, redness, and heat, these are all these. Coming to the now we will discuss some drugs with similar and differentiating features of sulfur and Morgan. Anxiety about health, fear in a crowd, similar features, sulfur and Morgan Pure. Both are hot. Both desire for butter, egg, fat, salt, sweets, desires food which makes him worse, intolerance to egg, fat and rich food, aversion to egg and fat, losses of heat, plethoric constitution. In both the cases we find, and in both the cases we find the dark complexion rather than fair, and we find the intolerance of woolen clothing in both the cases, diarrhea aggravation in morning, itching of the hemorrhoids, backache aggravation at night, relieved during motion. So this is a psychotic symptom. We find in case of Morgan Pure, and the brittle nails also. So many more symptoms of psychosis, syphilis, and sora also we find in case of Morgan Pure. So what are the contrasting features? How to differentiate? In sulfur, we find anxiety of business, anxiety for children, family, one's own health, of conscience, about future. Sulfur has very much anxiety about future. During chill, before and during menses also there is anxiety we find in case of sulfur. But in Morgan Pure, we find anxiety when alone, we find it in case of Morgan. In sulfur, we find usually irritability during and after menses. But the remarkable feature in case of Morgan Pure is irritability during menopause. During menopause, we find in case of Morgan Pure, irritability is aggravated. Indigestion in sulfur, indigestion from taking coffee and milk. Here we find indigestion from taking bitter and sour food. Nausea in sulfur from taking coffee and meat. In Morgan pure, nausea from eating egg and fat. Coming to next drug, we will discuss alumina. Anxiety about health, similar features. Aversion to company and irritability we find in both the drugs, both in alumina and Morgan. Prostration of mind, sadness, suicidal disposition, we are having many more drugs. But in Morgan pure, specific is from zombie. And in alumina, we won't find that. So weeping we find in both the drugs. Catarrh, eustachian tube, we find in both the drugs. Smell is diminished, smell wanting due to anosmia, because Morgan pure is a very good drug for frontal sinusitis. Here we find in alumina we find these similar symptoms also. And taste is bitter, diminished, loss of taste we find in alumina and Morgan pure. Irritation, bitter, sour, and water brass we find both in alumina and Morgan pure. And liver complaints, alumina is also a very, very good drug. And in Morgan pure also we find a very good drug. These are also the similar features of alumina and Morgan pure. We find diarrhea in morning, fissure in rectum. Already we know alumina is a very good drug for constipation, hemorrhoids. Even if this soft stool voided with a difficulty, just like carbobase, alumina is a very, very good drug. Leukorrhea, we know, very good drug for alumina. Copiousness is the differentiating feature. In Morgan pure, we won't find that, but excoriating alloys, we find both alumina and Morgan. Okay. Copious menses in both the drugs, we find alumina and Morgan pure. And both the drugs, we find brittleness, skin eruptions, itching, vesicular eczema, we find in alumina and in Morgan pure. Process of heat also we find, and varicose veins. Of course, Morgan pure is very well indicated than alumina, and the pace of the disease is more death in case of Morgan pure, what we won't find in alumina, but still then both are good drugs for varicose. To differentiate, alumina is chilly, we know lack of vitality, and Morgan pure is hot. Anxiety of conscience we find in alumina, as if he has not done his duty, just like cyclamen, we find this symptom in case of alumina. Alumina anxiety about future, about own health, from sad thoughts, but in Morgan pure we find anxiety when alone. And fear of animals when looking at blood, alumina is a very, very good drug when looking at blood. Okay, impending disease of falling of knives, alumina is also a very good drug, which is not found in case of Morgan pure. Fear of being poisoned, just like Rostux we find in case of alumina, but in Morgan pure we won't find these symptoms. And desire aversion, already we know the alumina, desire for cabbage, indigestible things, potato, raw food, one drink, and what we won't find in Morgan pure. And aversion also we find in alumina, meat and potato. In Morgan pure, aversion to eggs. Indigestion we find in alumina after taking cold food, potatoes, and here in case of Morgan pure, indigestion after taking fat food. Okay. Nausea specifically after taking egg and fat, but in alumina we find nausea after potato. Desire for a potato and intolerance to potato, aversion to potato we find in case of alumina. Back pain after taking potato also we find in alumina. But in Morgan pure we find back pain aggravation at night. and relieved by continued motion we find in case of Morgan. Next coming to, we will go first for calcarea car. Calcarea car, many a times we go for calcarea car. What is the similar features we will think of Morgan pure and calcarea car, that is anxiety about health. Okay. Frequently we find the very common features and we get confused in calcarea car and Morgan pure, where to, what to write, where to go. So anxiety about health, similar features, fear in a crowd, irritability, prostration of mind, desires egg, fat, salt and sweets, aversion to fat, intolerance to egg, fat and rich food we find in case of both the drugs, calciracar and Morgan pure. See, desire and intolerance for egg we find in both the drugs. But in Morgan pure also we find aversion to egg in some individuals. Menses, copious, metrorrhagia in both the drugs. Leukorrhea, acrid, excoriating, offensive, yellow in both the drugs, calciracar and Morgan pure. But in calciracar, we find very thick, viscid leukorrhea. We find in case of, and the aggravation before and after menses, we find in case of calciracar, but we won't find in Morgan. Smell wanting, anosmia, nose, smell wanting associated with a sinusitis, we find in both the drugs. Corners of mouth cracked in both the drugs and brittle nails in both the drugs. So how to differentiate? We find calciracar is chilly, Morgan pure is hot. In calciracar, we find the anxiety after hearing of cruelties about business, about in dark. We find in case of calciracar. Calciracar can't hear cruelties. Okay, and very much anxiety about business because we know calciracar for calciracar becomes to take responsibility, takes responsibility, but not so hard and fast about the taking responsibility. That's why about business becomes the anxiety is increases in case of calciracar. Again, calciracar, the keynote we know the easy fatigue. It becomes very easily fatigued with easily tired, and it can't go for hard work in business. That's why the anxiety increases in case of calciracar. And anxiety in a dark also we find in calciracar. But in Morgan pure we find the anxiety when alone. Tongue fissured in calciracar, corners of the mouth cracked in case of Morgan pure. Indigestion after taking cold, after mental exhaustion, after milk, we find in case of mental exhaustion aggravates most of the situations in case of calciracar. Even if anticipation aggravates in calciracar. But in Morgan pure, it's not like that. Indigestion after taking bitter, sour food, we find in case of Morgan pure. In calciracar, desire for chalk, charcoal, chocolates, earth, egg, indigestible things, milk and beans. And in Morgan pure, we find butter, desire for butter, food which make him worse. Morgan pure desires, which make him worse. That are desire, that is like eggs, like cat food, like chocolates. They aggravate the conditions also. And but desire is also there. And aversion to milk is in calciracar, aversion to egg is in Morgan. Nausea after taking milk from smoking, milk from smoking in calciracar, nausea after eating egg and fat we get in Morgan. History of croup and coryza we find in calciracar. In case of Barretta, we find recurrent tonsillitis, but in calcarea, we find recurrent croup and coryza. In Morgan pure, we find recurrent tonsillitis. Next is calcarea flow. So So in calcarea floor, we find the similar features like desire for salt, sweet, aversion to egg and fat, intolerance to egg and fat, backache, aggravation, beginning to move, relieved on motion. Usually we find in case of calcarea floor and Morgan pure. In Rostox also we find in Lycopodium pulsatilla medorinum also we find these similar features. In calcarea floor we find they are usually diaric, and in Morgan pure also we find uh, most of the time they are diaric. Osteoporosis we find in both the cases. Complaints of liver we find in both. Metrorrhagia, uterine fibroid, brittle nails, varicose veins. Calcarea floor is a very, very good drug. And as the congestion is the keynote, Morgan pure is also a very good drug for varicose veins, varicose ulcers, hemorrhoids, like that. So how to differentiate? We find thermal reactions. Calcarea floor is to chilly to some extent, and Morgan pure is quite hot. Anxiety about future, about one's own health, about money matters. Calcarea floor, anxiety is much more, just like bryonia we find in case of calcarea floor. But in Morgan pure, anxiety when alone. Fear, causeless fear, fear of cancer, fear of high places, fear of mice, fear of misfortune, fear of poverty. Calcarea floor is there is a very, very good drug for fear of poverty. Okay. Fear in a crowd and about health is in Morgan. So desire for cold drinks, cold water, pickles, pungent things, sharp food, acids, spices we find in case of calcarea floor. But in Morgan pure we find desire for butter, fat, food which makes it worse. Intolerance we find in alcoholic drinks, in calcarea floor, cold drinks, cold water, cold food, sweets. But in Morgan pure, intolerance to rich food. Rich food, of course, intolerance to egg and fatty food. Nausea after taking alcohol in calcarea floor, nausea after taking egg and fat, we get in case of Morgan. History of recurrent styes, recurrent abscess, we find in calcarea floor, and the history of recurrent tonsillitis, we get in case of Morgan pure. So this is all about the calcarea floor and Morgan pure. Next, we can think of graphitis, a very, very good drug. We will go for graphitis. What are the similar features we must think? That those are the, because graphitis is a very good drug for the skin conditions, and Morgan pure is also a very, very good drug for skin conditions, or most all types of. So what are the common similar features we find? In mental sphere, we find aversion to crowd, fear in a crowd, aversion to company, frustration of mind, sadness, suicidal disposition in both the cases, desire for sweets, intolerance to fat, indigestion after taking sour food, restless sleep, constipation, anal fissure, and corners of the mouth cracked in both the drugs, graphitis, Morgan pure, calcarea car. We have seen all these things. Uh, Next is ulcers in stomach and duodenum. Graphitis is a very, very good drug for duodenal ulcer. The pain relieved after eating. We know many drugs like that. The starting from the graphitis, chelidonium, petroleum, sorinum, also anacardium, many more drugs. So also in Morgan pure, we find this symptom. That's why that is also a very good drug for the duodenal ulcers. Leukorrhea is acrid, excoriating, offensive and yellow. Backache relieved on motion we find in both the drugs, graphitis and Morgan pure. Cracked skin of bends, joints, hands, heels, and brittle nails we find in case of graphitis and Morgan pure. In both the drugs we find the similar features. Coming to the contrast, we find graphitis is chilly. We know the leading symptom. Graphitis is chilly, obese, and if red line 5 symptoms can be thought of, that is the chilly, caustic, obese, aversion to sweet, and susceptible to cold, and the wound heals lately. Tendency to suppuration. These are the guiding features of graphitis we know. So chilly patient in a leading chilly patient graphitis comes, and Morgan Pure is a leading hot. Anxiety of conscience we find in graphitis. Anxiety when alone about health we get in case of Morgan Pure. Irritability during headache. Irritability during headache in graphitis, and irritability during menopause we get in case of Morgan. Desire for milk, bitter food and drinks, chicken we get in graphitis, and in Morgan Pure we find desire for sweet, salt, butter, and foods which make it worse. In graphitis we get nausea after taking sweets, but in Morgan Pure we get nausea from egg and fats. In graphitis, we just like calcarea, we find recurrent coryza, and just like the calcarea floor, we find a history of recurrent styles. In Morgan Pure, we find a history of recurrent tonsillitis. So coming to petroleum, the similar features we find, that is this aversion to company, fear in a crowd, irritability, prostration of mind, sadness, weeping, desire, sweets in petroleum, aversion to fat, again diarrhea aggravation in morning. We are having many more drugs like natrum sulfbryonia, rumex, sulfur, psychotico. We have petroleum, we have Morgan Pure, many more drugs, aggravation in morning hours. And aggravation after eating we find in case of petroleum and also in case of Morgan Pure. In these symptoms also we are having many more drugs like Nux vomica, Loge podophyllum, I did not to discuss. Urine means strong odor in both the cases, offensive food, specifically offensive food sweat, we get in both the cases, petroleum and Morgan Pure. Copious menses and metrorrhagia, leukorrhea, usually acrid and excoriating, we get in both the cases, petroleum and Morgan Pure. Hot flossing, we get in both the cases, petroleum and Morgan Pure. And complaints of spleen and chilblains, we find petroleum and Morgan Pure. Many more drugs are there. So coming to contrast, we find thermal reaction is chilly in petroleum, Morgan Pure is hot, anxiety in company we find in crowd, about future we find in petroleum, in Morgan Pure we find anxiety when alone, and about health we find in case of Morgan Pure, irritability during menses we find in case of, and during poison we find in case of petroleum. But in Morgan Pure, we find irritability during menopause. Morgan Pure is a very, very good drug, irritability during menopause. Just like in lachesis. In lachesis also we find irritability aggravation during menopause. CPI is also a good drug for irritability aggravation during menopause. And in petroleum, we find desire for alcoholic drinks, beer, brandy. And in Morgan Pure, we find desire for salt, butter, egg, fat, and foods which make them worse. Aversion to butter, cabbage, meat, sweets, warm food, and wine we get in case of petroleum. And aversion to egg we find in Morgan Pure. Intolerance we find alcoholic drinks, beans, cabbage, uh, dry food, melons, milk, peas, sour fruit, vegetables. We find in case of petroleum, cabbage diarrhea causes diarrhea in case of petroleum, what we know. and the intolerance of egg, fat, and rich foods we know in Morgan Pure. Headache every day, periodical, petroleum. This is a very good symptom in petroleum. Periodical headache and every day. But in Morgan Pure, we find every week headache. Just like we find in China, we find in arsenic also headache aggravation in every week, just like Morgan Pure. Nausea while riding on horseback, on a carriage, in a car, just like coculus we find in case of petroleum also. But nausea after taking egg and fat we find in case of Morgan Pure. So really time is very short. Otherwise we would have run for tuberculinum. I was thinking just contrasting features of tuberculinum and Morgan Pure. Let me discuss. Many more similarities are there, but fear of cats and dogs we find in case of tuberculinum, and in Morgan Pure we find fear of crowd and about health. In case of tuberculinum, allergic constitution we have, and in Morgan Pure we find plethoric constitution. In tuberculinum, headache accompanied by digestive troubles, but in Morgan Pure, headache accompanied by nausea. Why I discuss tuberculinum, but many times I have found that in my practice I have come across a confusion between tuberculinum and Morgan Pure. That's why only the contrasting features basing upon the mental symptoms I have discussed. So in my clinical practice, I can say that the recurrent bartholinitis, the repeated migraine, chronic cervical spondylosis, the peptic ulcer, duodenal ulcer, in skin, various types of skin conditions, I have seen that Morgan Pure is working very, very well. Lastly, thank you to the organizers for giving me a spot to stay. Thank you, everyone. Any questions, please?
Yes. Yes, Dr. SUMANA KUMARI PANDA, madam. It's really a very good session. You really beautifully narrated about this Morgan. And we never thought that this much of thing can be done with this particular medicine. Anyway, congratulations, and it is the time for discussion. And those who want to participate in discussion may please raise your hand so that we can allow you to unmute yourself.
Thank you, Dr. Dhanesh, for the appreciation.
Yes. Is there anyone? Yes. Ambadi madam, you can unmute yourself. You can speak. And you can say a vote of thanks also to this session. Yes, yes, Ambadi madam, you can unmute and you can say a vote of thanks also.
Namaste,
Okay,
madam.
namaste, Mrs. Pandey. You are a very nice program. You are inspiring us to study Bachelor of Days. Sorry, this
Bowel
nosodes. Batch is the inventor of this bowel nosodes. Then it was very nice session. I convey my thanks in the name of IFPH as well as me. Thank you a lot. You should come again. As usual, it was very nice class. Okay.
One request, madam, also. I want to listen from you and Dr. Chandra on the gynecological cases and infertility cases. Your papers are very interesting, but please come across in English. I can't follow Malayalam.
We will keep in contact. You can very well contact us, Dr. Pandey. Okay.
I request Dr. Dhanesh to conduct such gynecological obstetrical issues specifically in English. I want to listen from Dr.
Okay, we will try. We will try, Dr. Pandey.
Yes,
okay.
Yes, definitely we will arrange this
within some few days, I will take one class. Okay.
Yes, yes, yes. In
Okay.
English,
Okay.
madam, not in
English.
Malayalam.
No,
I
I
can
know,
follow.
English,
Yes,
in
you
English.
can. There are certain sessions taken by Ambadi Madam and Chandran Doctor about infertility, and we will upload some of them in the YouTube. So if you search in YouTube, you can find some of them. Or I shall
Yes,
try
yes,
to.
I have searched, but very less. More are in Malayalam.
Okay, okay. Anyway,
Okay,
thank you.
okay, Mrs. Pandey, we will take in English. Okay.
Okay, thank you.
Okay. Thank you,
Thank
Very,
you.
madam.
very
Thank you.
Thank
recently, I will take. Okay.
Okay, thank you, Dr. Ambadi Madam and Sumana Kumari Pande Madam, and those who attend the English session, and our moderator, Dr. Richard Tripathi. Tomorrow we will have a session from Dr. Amrita Manoharan, and she will be taking from hormonal chores to harmony, homeopathy and PCOD. So another a big day is awaiting for you. Hope all of you will join us tomorrow at the same time. Thank you all. Good night. It's
Thank
over.
you. Thank you, everyone.
Good
Good
night.
night.
Good night.
Namaste.
Good night, Mrs. Pandey. We will keep in touch with you.
Yes,
Okay.
yes, yes,
You
madam.
can very well call us, both of us, at any time.
Okay, thank you,
Okay, we will
madam.
have
I will be in
discussions.
touch.
Okay. Okay, ma. Okay, okay.
That's
Over
my
to
pleasure,
Dr. P.
madam.
Shaila to moderate the Malayalam session.